My name is Lewis Cowie. I'm a data analyst at the Australian Government Department of Education, Skills and Employment. And I'll be speaking about our research on the impact of mental health on student higher education completion rates. Firstly, I would like to respectfully acknowledge the traditional owners and custodians of the country throughout Australia and pay my respects to the Whadjuk Noongar people and their elders past, present and emerging, where I'm speaking today. It's here in Perth, Western Australia. And I'd also like to extend that respect to any Aboriginal and Torres Strait Islander people joining us today. So part of our department's portfolio is Australian higher education sector. And one of the research questions we are interested in is what factors impact the successful completion of a higher education course? Why is this interesting or important? Well, students' higher education and completing it has been linked to a number of lifelong benefits, including higher income and lower reliance on welfare. However, the financial and opportunity costs to the individual and the government to undertake study is substantial. So improving our understanding of the factors that drive completion rates are important. One particular factor that isn't well understood is mental health. It's a growing issue here in Australia, and its impact on higher education completion hasn't been researched too extensively here. So for the first time in Australia, we investigated this relationship using linked population level data made available through the Multi-Agency Data Integration Project, or MADIP. So MADIP is a cross-government dataset that links data on Australians from different federal government departments, including healthcare, education, welfare, personal income tax, and census demographic information, amongst other data. And this provides a rich picture of Australia's population. The official statistical body in Australia is the Australian Bureau of Statistics, and it is responsible for MADIP, and it builds MADIP linking and de-identifying the various data sets. The Bureau of Statistics then provides access to researchers such as myself to conduct research for statistical purposes in a secure environment, safeguarding of individuals. So on to our project. To analyse completion rates, we used higher education administrative data linked to MADIP. So the Higher Education Information Management System, or HEMS data set, is the one that got linked, and this includes information about student commencements, enrolments, and completion at the course and unit level. Importantly, this is for Commonwealth government supported students and domestic students only. So to answer our research question, does mental health influence completion? We also had to construct a mental health measure. So to do this, we use linked Medicare benefits schedule data. So the Medicare benefits schedule forms the basis of Australia's universal healthcare system. Australians use Medicare to access an extensive range of healthcare services for little to no cost, including mental health items. So to identify a mental health issue, we used mental health related Medicare services, such as psychology visits, psychiatrist visits, amongst others. And we followed a method used by the Australian Institute of Health and Welfare to work this out in their annual mental health report. Using Medicare data as a proxy for a mental health issue has advantages and disadvantages. An advantage of using transactional health data is it's recorded at the population level, so it avoids any survey response issues or any issues associated with surveys. However, government-supported visits are an imperfect proxy for a number of reasons. A mental health visit or script is transactional record and does not indicate a diagnosis of any condition necessarily. Additionally, any mental health services occurring under different items or in private practice or hospital visits and even health line data is all missing, and these are all important sources of support. So this high-level chart shows all students enrolled in any course in higher education each year and the percentage of those students each year that accessed a mental health service. So I'm showing here the Medicare services as well as pharmaceutical prescriptions for mental health related pharmaceuticals. So similar to Medicare, the government sponsors or subsidises a large number of prescription medicines for various things, including mental health medicines, and those ones have been counted here, such as antidepressants. Unfortunately, the data is only complete from 2013, as you can see. So it's only being shown from 2013. And also, as you can see, mental health is a growing issue in the higher education system, reaching 21% of students in 2016. So this possibly indicates a growing awareness of mental health or a genuine increase in issues in higher education. So, given this is a growing issue, to analyse completion rates, we opted to analyse the 6-year completion rates for bachelor degree students in higher ed across Australia. Specifically, if a student completed a bachelor course or not in the next 6 years. So this is consistent with how the official publications do it. And we investigated a de-identified group of about 120,000 students commencing a bachelor degree in 2011 for the first time. And about 30% or 36,000 of these students used a mental health service at some point or another in the next 6 years. Do note, we narrowed the scope to just the Medicare services and excluded the pharmaceutical data due to it being incomplete. And what we found was students that used mental health services had lower completion rates overall, so had used at least one. And to test this, we controlled for, to robustly statistically test this, we controlled for confounding factors also created in MADIP. These included things such as gender, socio-economic status, tertiary entrance score, and remoteness. And what we did was, using these confounding factors, we created a matched subsample using matching methods. And this subsample will hold all of these confounders equal. And then using this matched subsample, we ran a regression, again controlling for confounders, to test if mental health impact, all else being equal, really impacted completion rates. And after all of this controlling, we still found that students that accessed mental health services had lower 6-year completion rates than those that did not use any service during the 6 years. So as you can see on this chart, we're showing the unadjusted completion rates. So they're the sort of raw scores. And then after we've controlled for everything, the modeled matched sample completion rates. And as you can see, a bit of a gap between those that accessed services and those that did not. So in addition to this analysis, we conducted some variety of supplementary analysis, including analysing the timing of service. So it appeared if you access services before your last semester, you had a better chance of completing than if you accessed after your last semester. And we also found that if you had a more severe condition, as measured by either volume of the mental health service, as shown in this chart here, during the 6-year period, you had a lower completion rate as well. However, these sort of supplementary analysis, we recommend a deeper dive to really unpack some of these trends we're seeing. So mental health was one of many factors we analysed in this project. As you can see detailed on this slide, we analysed other things such as gap year and working during study. Cross-government data sets such as MADIP make this kind of research possible, and they offer us powerful insights into the students. This is the first time in an Australian context that higher education outcomes have been linked to such a wide range of student information, including health, employment, socio-economic information, and income support status. So thanks for listening. The full results are available on the link on the slide. Make sure you catch my colleague Megan Ladbrook's presentation on Aboriginal and Torres Strait Islander students also at the conference. Thank you.